Hi, I'm Kimberly Tiso, President and CEO of ABLE South Carolina, and one of the founders of the Disability Vaccine Access Opportunity Center, or DVAO. My pronouns are she and her, and I am a white middle-aged woman with blonde hair that sits above my shoulders, and I am also a proud disabled woman who has one leg and walk on crutches. I first want to thank our co-founders of DVAO, the Independent Living Research Utilization, or ILRU, for teaming up with us on all areas of this project to support CILs. Also to our partners at the Partnership for Inclusive Disaster Strategies for providing training and support and developing the tools and resources within DVAO. Our amazing funders, the CDC Foundation and the CDC at the U.S. Department of Health and Human Services, and our friends at the National Association of County and City Health Officials for helping CILs bridge the gap with local health departments. And a special shout out to all of the funded DVAO CILs who are part of this project from the very beginning. As grassroots, cross-disability focused, and disability-led organizations, Centers for Independent Living are often at the forefront of adapting and responding to emergencies in their communities. At the beginning of COVID-19, very little information was produced regarding the impact of the pandemic on people with disabilities. CILs from across the country raised the alarm bells as disabled people were being left out of planning, vaccine access efforts, and overall just being an afterthought. And disabled people were dying across the country. While CILs received funding to assist with the pandemic efforts, not all CILs were eligible. Part B Centers for Independent Living did not receive any funding, and the CDC graciously opened up funding to leverage Part B CILs to ensure people with disabilities were receiving equitable access to the vaccine within all CILs, Part B and Part C. This was the start of the Disability Vaccine Access Opportunity Center. As a result, 39 Part B CILs were part of this effort and received funding and outreach efforts, along with tools, training, and technical assistance, while also receiving timely information regarding changes in vaccines and the importance of disabled people receiving vaccines while addressing hesitancies and barriers. Together, these 39 CILs reached over 27 million individuals, created 4,065 partnerships, trained 2,829 individuals, provided PPE to 100,295 individuals, and an estimated 25,411 people received their COVID vaccination. Together, we saved lives. As we know, COVID-19 is not over and is still one of the top killers for the disability community. Therefore, we are here today. We are opening up the DVAO resources and toolkits to all CILs to continue saving lives by equipping our consumers with the needed information, building CIL capacity, and being better prepared for future pandemics. We are excited to bring you the DVAO Resource Hub. To stay up to date with new resources and future trainings, make sure to subscribe to our DVAO email newsletter by visiting bit.ly/DVAO email. Again, that's bit.ly/DVAO email. And now I will pass it to Larry Wenger, who will tell you more about the Resource Hub.
Hello, my name is Larry Wenger and I'm the Senior Director of Innovation here at ABLE South Carolina. I'm glad you've been able to join us today. By way of visual description, I'm a middle-aged white male with short brown gray hair, light skin, wearing a dark button-up collared shirt. My pronouns are he, him, his. And again, I'm glad you've been able to join us today. Much of the webinar that you're going to participate in today is recorded ahead of time in an effort to prevent technical problems from surfacing. We'll be showing slides, website content, have presenters from various places across the country, and also ASL and CART or captioning available. Lots of things going on, and we felt this was the best way to reduce the risk of technical problems during the webinar itself. We are here today to highlight the work of the DVAO project both over the past couple of years and to talk about what's ahead for DVAO. The goal of this project ultimately, as Kimberly shared, has been to help Centers for Independent Living better support people with disabilities during the COVID-19 pandemic. And now we're shifting gears to continuing to help you do that as we look ahead to the potential for future public health emergencies and better preparing ourselves with the goal of achieving better outcomes for people with disabilities in our communities. To that end, I'm really happy to share with you that the DVAO website now includes a number of tools and resources that are available to you. These include toolkits, how-to guides related to accessible vaccines, guidelines for pharmacies, and a number of other resources that we'll talk about later in this webinar. We'll also talk about what's ahead for DVAO, trainings that will be available, mentoring from Centers for Independent Living who have successfully engaged with public health, and other resources as well.
Hello, my name is Sarah Lyons. I am the Senior Program Analyst for the Health and Disability Program at NACHO, the National Association of County and City Health Officials. My visual description for today, I am a white woman with short blonde hair, and I'm wearing a black and white plaid blazer. First slide I'm sharing with you today is how local health departments impact our lives every day. NACHO's mission is to improve the health of communities by strengthening and advocating for local health departments. There's approximately 3,000 local health departments across the country. The image on the screen shows an infographic with images on the different types of work that local health departments participate in their communities to promote and protect the health of people where they live and work. Some examples of the infographic on the screen on the topic areas that health departments are involved in are immunization, food safety, infectious disease, chronic disease, injury and violence prevention, emergency preparedness. NACHO conducts a national survey every 3 years to learn about the top programs and services local health departments provide to their communities. If you're interested in seeing the data from our latest, it's called the Local Health Department National Profile. We recommend you viewing that. You can look up the national profile of local health departments. Next slide, I'm going to provide a little overview of NACHO's Health and Disability Program. We are supported by the National Center on Birth Defects and Developmental Disabilities at the Centers for Disease Control and Prevention, or CDC. The overall goal of our program is to promote the inclusion and engagement of people with disabilities in all local health department programs, policies, and services. Next slide, I'm sharing just a little information on how NACHO educates local health departments about the importance of disability inclusion. We know that people with disabilities are an important part of our communities, and we want to make sure that local health departments know how to include people with disabilities in their public health programs and services. We do this by developing trainings. We have some formal trainings through our learning management platform called NACHO University. We offer direct technical assistance, grant funding opportunities, and many communications activities, including blog posts, monthly newsletters, webinars, and conference presentations. We are also always providing technical assistance to local health departments. We always suggest partnering with their local Centers for Independent Living and other community-based organizations that serve people with disabilities, because we know you are such a crucial part of disability communities in the U.S., and we know that you are experts in this space, and we encourage local health departments to connect on learning more how they can incorporate people with disabilities in their programs and services by working with Centers for Independent Living. I'm just going to provide a few examples of opportunities for collaborations between health departments and centers for independent living. Many local health departments are offering training to their staff, and we think it's important that disability etiquette and other conversations around disability inclusion are offered to local health department staff. We recommend that health departments are reaching out to Centers for Independent Living to work with them on offering trainings to their health department staff. And in reverse, there's many health educators and local health departments that are able to provide disability partners like you and their consumers on different public health topics that would be important for communities to know. We also recommend health departments to be thinking about accessibility and accessibility expertise around the ADA and interpreter services, and for working with Centers for Independent Living, because we know you are experts in this space. We also recommend that local health departments are inviting Centers for Independent Living and disability organizations in opportunities around health equity coalitions, as well as partnering in community health needs assessment and improvement planning. And then finally, I just wanted to provide a few examples about how current NACCHO grantees are collaborating with Centers for Independent Living. We have a project around emergency preparedness that came out of the COVID-19 pandemic, where several what we're calling disability specialists or full-time health department staff that are working with disability partners around preparedness. They are embedded, several are embedded within disability organizations like Center for Independent Living. We also have had many health departments partner with Center for CILs for COVID-19 vaccine sites, as well as participating in preparedness planning meetings by reviewing preparedness plans and providing feedback on how they could be more accessible for people with disabilities, as well as participating in drills and exercises to really help understand how these plans are operationalized when there's an emergency. And we really encourage disability organizations like CILs to be a part of these conversations so you can provide critical feedback to make sure people with disabilities are prepared in an emergency. And finally, I just wanted to provide my contact information to you. We recommend that you, if you're interested in learning more about our project and the activities that we do with local health departments, to visit our website through the Health and Disability page on NACCHO.org. Thank you so much for the opportunity to speak with you all, and I look forward to finding ways for us to collaborate in the future. Thank you so much.
My name is Herman Perotti. I am the co-executive director of the Partnership for Inclusive Disaster Strategies, the Nation Disability-Led Disaster Hub. I use he and elle pronouns, and I'm a Puerto Rican man wearing a black button-up shirt. I have long brown curly hair pulled back today, and I'm wearing glasses and sitting in my wheelchair. Why COVID and prevention actions are important. COVID is on the rise. Wastewater surveillance indicates an increase in infections, and hospitalizations have been going up. We know COVID impacts older adults and disabled people in every community the most. And we do not yet fully understand the implications of long COVID. So don't forget, keep safe by properly wearing an N95 or KN95 mask in public, practice social distancing, wash your hands often, and keep up with boosters. What have we learned from COVID-19 and vaccines from early on? In the pandemic in 2020, at the onset, people with disabilities faced unequal access to health care. Hospitals developed guidelines that were often based on biases against people with disabilities and older adults. Our siblings and institutions were cut off from seeing visitors, and the PPE distributed in there was inadequate. When the vaccines began to be rolled out, the disability community did not have equitable access, and public health was not aware of their legal obligations, including physical access, captioning and sign language interpretation, screen reader compatible websites, and material in accessible format. But we began collaborating and saw the government fund disability organizations and aging organizations to do the dedicated work to support our communities through the pandemic. The role of public health departments play in your communities. Health departments play a vital role in the community by monitoring and preventing disease outbreaks, providing health services and education, and setting and enforcing public health standards and regulations. They conduct research to understand diseases and collaborate with community stakeholders to improve health outcomes, and are often frontline responders in public health emergencies. Their goal is to ensure the overall well-being and safety of the community that they serve. Some examples of how to collaborate with public health in your communities may include cultural awareness initiatives and public awareness campaigns, also vaccination clinics and resource distribution like PPE.
Thanks, Herman. As we move forward with the DVAO project, I want to talk more about what's ahead in the future. And one of those things that we will be doing is offering many more trainings and hands-on opportunities for centers to learn more about building public health coalitions and engaging with public health in your state or region. Our goal is to use this time to help you build the tools and resources and knowledge and partnerships that you will need to be successful. To that end, we'll be offering a number of trainings over the next several months that I want to take a moment to highlight now. In September, we'll be offering a training focusing on emergency preparedness. This topic is closely related to public health and is really important to people with disabilities in your community. People with disabilities are highly impacted by emergencies and public health emergencies that happen in your community, and we want you to have the tools and resources to be able to respond. Next, we'll be offering a session that focuses on an introduction to public health. Your center may or may not be interacting with your local health department or otherwise participating in public health activities in your community. There could be many reasons for this, but we know that building those relationships and having those partnerships would have dramatically changed what happened at the beginning and during the COVID-19 pandemic. It would have resulted in better outcomes for people in nursing homes and people with disabilities more broadly in your community. And so we want to focus on building those partnerships and building those coalitions now so that you can begin working on issues important to people with disabilities before the next public health emergency. The next webinar will focus on working effectively with public health. We will hear from Centers for Independent Living who've been successful over the last couple of years at building those relationships and achieving better outcomes for people with disabilities in their community. And we'll talk about why this work is important. This session will help you to better understand and implement strategies that can help you be successful. In addition to that, we'll have a session that will focus entirely on disability and intersectionality. We know that people with disabilities who are also at the intersection of race and other issues are impacted much more when it comes to public health emergencies and disasters. The session will really focus on topics related to that, and we'll hear from centers who are doing this work along with other allies and folks from the public health community who will help us better understand the importance of being mindful of these concerns. While all sessions will include this important aspect, this session in particular will take time to focus on these issues. And finally, we'll have a session that will focus on bringing the appropriate resources to the table to help you be successful. As you build a public health coalition in your region or state, you'll need a number of resources, including funding and the right people at the table to help you be successful. And this session will help you in that area. In addition to all of this, we will also offer opportunities for you to receive support from Centers for Independent Living who've already been successful in this area. Think of it as working with a mentor who's there to help you be successful. Our goal in all of these activities is to help you create and begin making the changes on the systems level now that will help to result in better outcomes for people with disabilities in the future. To position your center to be more successful and to make a difference in your community. To make it so that we don't have to reinvent the wheel in the future, that you'll have all the information and tools and resources you need. We're glad that you're on this journey with us and look forward to working with you.
Hello everyone, my name is Joey Vega and I use he, him pronouns. I am the Project and Evaluation Coordinator for ILRU. A brief visual description includes I am a Hispanic male with dark hair, I have a full trim beard, and I'm currently wearing a navy blue polo shirt. So I'll be briefly talking about some of the results and benefits of the DVAO Center. So why did Independent Living take the initiative to lead the efforts of the DVAO Center? As we all know, people with disabilities, especially those in nursing homes, were most impacted by COVID. IL is people with disabilities, and we know the needs of our communities. We are trusted in our communities as a voice for the disability community. The future of the DVAO initiative includes providing tools CILs need to engage with public health and supporting CILs in creating regional and statewide public health coalitions and partnerships. Outcomes of this efforts include CILs public health departments and communities will be better prepared for future public health emergencies. CILs will be better prepared to take advantage of opportunities to educate and advocate for and about disability concerns and IL philosophy. Better outcomes for disabled people in our communities when the next public health emergency happens. As we move forward, we look forward to helping you to form a stronger partnership between your CIL and public health, helping you to establish a public health task force or coalition in your area focusing on disability, helping your CIL identify potential funding opportunities to support this important work, and helping you to increase awareness of your CIL in your community. Thank you again so much, and with that, I'll pass it on over to Larry.
As noted earlier in this webinar, the Disability Vaccine Access and Opportunities Center, or DVAO, has developed a number of resources, toolkits, and online information to help you along the way. Our goal has been to provide centers with the resources they need to successfully advocate for access to vaccines and other resources during the COVID-19 pandemic. And now we're shifting gears to helping you prepare for the future and what might be ahead. With that in mind, we've been developing a number of resources that we hope will be helpful to you as we go forward. All of these resources and tools can be found online at dvao.able-sc.org. Again, dvao.able-sc.org. This website includes a number of toolkits and informational guides and even webinars that will be updated on an ongoing basis as we go forward. Look for additional resources to be added, including future trainings and other information. I'm proud to say that these are also offered in English and Spanish for the most part. One of the resources you'll find on the website is a guide to hosting accessible vaccine clinics. Well, many centers are very experienced in this and hosted a number of accessible vaccine clinics during the height of the pandemic. Others took a path where they partnered with other organizations to do that work. And others were able to simply promote access to pharmacies and more broadly vaccine clinics and sites in their communities. No matter what the case might be, we think it's important that you have a hands-on nuts and bolts guide that walks you through how to host an accessible vaccine clinic. Should the need arise in the future, you now have a ready-to-use and easy-to-understand guide at hand that can help you in this area. It includes basic explanations for accessibility, ADA requirements, and suggestions based on the success of other centers who have hosted these clinics. We've also provided a guide for pharmacies that might provide vaccinations on site. Again, it focuses on accessibility requirements and steps that your local pharmacy can take to be more accessible and welcoming to people of all disabilities and walks of life. Next, you'll find a webinar that provides an overview of strategies and successful steps taken by Centers for Independent Living during the pandemic that you might find helpful in the future. As said, this webinar includes tips and suggestions for how your center can be successful in supporting people with disabilities during a pandemic. In addition to this, we heard loud and clear from centers that having a better understanding and resources available to help guide efforts to identifying and securing federal funding opportunities would be helpful. And with that in mind, we developed a detailed toolkit that includes tips, suggestions, and examples of how to find and apply for and successfully receive federal funding. While there's no guarantee, we hope that this toolkit will be helpful to you in these efforts. And finally, we've provided a very detailed and thorough toolkit that includes tips and suggestions and real-world experience based on lessons learned about how to operate your Center for Independent Living, provide services, and things to think about during a public health emergency. This includes examples of documents and tools that you can use in the future. We hope that these resources and tools are helpful to you and your center as you continue to support the disability community. Before we go live to Kimberly, I want to thank you for joining us today and invite you to visit the website at dvao.able-sc.org to access all of the resources, trainings, and tools that we've talked about today. Watch for email announcements and further information in the future about DVAO and the resources and trainings we'll be offering to you. Thanks for joining us, and we'll go live now to Kimberly.
Now that you have access to the Resource Hub, we will be updating it as information about the vaccines change, as well as posting ongoing training and technical assistance to support you all.